Today, we're going to go over the optimal home exercise routine for anyone who has damage to their neurologic system that has impacted their ability to move the arm. Now, for some of you, this is going to be a little bit of a review, but I never think it's a bad idea to review some of the theory or rationale behind how I build a rehab program. But also for some of you that are new, it'll kind of be a one place you can go to get what I would consider all the components that make up a successful arm rehab home exercise program. If you're new to this channel, I'm Tara, I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injury, with the end goal of empowering you with as many tools as possible to take ownership of your rehab and live an overall more active, more mobile, pain-free, happy, healthy life. And with all that said, let's dive right into the topic of today's video. So again, some of this is going to be review. So for those of you that it's going to be review, rest assured I'm going to go through this really quickly and just hit the main points that I've done in previous videos. For any of you that are new, I will link all of the videos that I've done on this topic in the past in the description below. But big picture, let's just talk about the arm a little bit and what makes up a successful arm rehab routine. If you have lost movement due to damage to your brain or your spinal cord, it is critical that there is a stretching component. You can't regain movement if you have a lot of resistance, so there's always a component where you need to increase the tolerance of muscle lengthening. That'll make the movement component easier to tackle within this routine. Then of course you need a movement retaining component, and then finally you need a component where you kind of add a functional task. That's going to be different for every single person. I'm not going to really go into that in detail in this video, but just know that this will probably be the stretching and the movement retraining that I think is essential. And yes, for those of you that ask a lot about the wrist and the hand, it's going to include the shoulder, elbow, wrist, and hand in this video today with some exercises for you. But when it comes to actually ending your routine with a functional activity, I would choose something that has meaning and purpose to you, whether that be brushing your teeth, opening a tube of toothpaste, prepping food for a meal, getting dressed, turning on a light switch, which involves reaching and involves a little bit of coordination with your hand. Whatever it is, you should find something that you would be proud of yourself if you accomplished X task. So when it comes to the stretching, the key areas that I think are the most important that people hit every single day, if you are someone that has limited movement in your arm, is stretching out everything on the front of the shoulder, especially if you want to work on reaching backwards behind you. And then of course, all the muscles that are pulling the arm in and down. And again, especially if you want to work on reaching your arm away from your body. So the first one is going to be one that I've shown before, but you're just going to lay with your arms straight out to the side. By far my favorite stretch for the arm. If this is the shoulder we're stretching, you're just going to put that arm out to the side and try and rotate as much as you can. That really hits all the key areas for the arm. Now, if you can, which some people can't, but the other position is having the arm in what we call a W position and then doing the same thing. This one's going to be a lot harder for some of you, but definitely super, super important. And then the next stretch that I think is really important is just pushing the arm straight back, especially for those of you that can't reach into your back pocket or you do have trouble getting that arm back to push up from a chair. Just holding onto a cane and just pushing that arm straight back every single day. And you want to hold each stretch for 1 minute. And then the other stretch we're going to do is reaching those arms overhead. Again, especially if you're working on reaching, you don't want any resistance. You don't want anything trying to pull that arm back down when you're trying to work on reaching the arm overhead. So just laying on your back, palms facing up, and I've shown this before, so for some of you this is just a review, and then you just want to reach back as far as you can. Obviously you're holding onto the cane with both hands, so you can use your other hand to help, and again you want to hold it for 1 minute. And then the last one, and the one that's really, really important, and I've shown this one before, is Again, we're going to stretch overhead, but we're targeting some different muscles underneath the arm that are very tight on a lot of people. You're going to keep your arm in like this 90-degree bend position, palms facing up and elbows in. And the elbow in part is really the most challenging part of this. When your elbows flare out, you're missing kind of getting that lat stretched out, which is what we're trying to target. You know those muscles are tight on you if you're someone that when you go to reach, your elbow is always going out to the side, or when you walk, if your elbow is going out to the side. So if that is you, I highly recommend that you invest in some straps like this. I'll put a link in the description below for these. I love them. But again, you don't want your elbows more than shoulder width apart when you do this one. And then again, you're just going to reach back overhead. You can see there's a 90-degree bend about in my elbows approximately, and those elbows are staying in. Try not to arch your back up, so really try and keep your back flat as you let that bar fall back behind you. And again, you're going to hold it for 1 minute. And that's it for the shoulder. And we are going to do stretches for the wrist and the hand and the forearm for those of you that have been asking for a long time for those exercises, but we will do those when we get to the arm hand component of this. And now that we have the arm all stretched out, let's go through a little bit of the rationale quickly as to what you want to focus on for the arm when you're deciding the exercises. There's two things that you want to focus on: the position for how difficult the activity is, so knowing kind of what your strength is at, where you are at in the recovery process. But you want to go gravity eliminated, which means the movement is parallel to the floor. That's easier. And then gravity against gravity, which means you go away from the floor with the movement. Everyone, I think, should start out with some sort of a gravity eliminated movement before going against gravity. That's number one. And then number two, and I've talked about this before, is you want to start out with maximum stability. So meaning you want every other joint as much as possible stabilized as much as possible, and then you decrease the stabilization as you progress the difficulty. So those are the two things, parameters or conditions that you constantly need to be weighing. If you can't do a movement at all and you're in the very early stages, maximum stability and no gravity. And then as you progress, maybe you go against gravity, but still staying stable. And then maybe you go no gravity, but less stability. And we'll go into examples of all these in a minute. But you can see you can play around with these two conditions a little bit to set you up for success for where you're at this moment. But let's just start with shoulder flexion. So shoulder flexion is reaching the arm up. Now, for most of you, reaching the arm up and not letting it rotate inwards is a challenge. So all the reaching overhead that we're going to do, we're going to try and do it with the arm externally rotated. It also structurally allows people to reach a little bit further. Most of you internally rotate when you reach up, so all of the reaching retraining that we're going to do, we're going to try and keep that arm externally rotated. So we're going to start laying down to give maximum stability, thumb pointing up, and you're going to do active assisted, so helping it with the other arm to start. And now you can see this part of the motion is against gravity because I'm moving further away from the floor with my hand. This part of the motion is with gravity. So what a lot of people have to do is active assist, help it with your other hand, get it to vertical first, and then try and let it slowly fall back in this direction. All right, so that'd be gravity assisted movement. And then as you get better, you can assist it to a little bit shorter position. So now you're going a little bit against gravity before you go back. And then maybe try from this position as you get stronger. But you can see there's where all the different layers of difficulty come into play for this one. And again, thumb is facing up the entire time. And then once you feel like you don't need assistance with the other hand, then you can try against gravity without assistance. Then once you get good at that, you can change the stability if you get really good at that. This is a big jump, but now you can do it less stable, and against gravity. So again, you could start with active assisted, but less stable, and helping it all the way up. And then once you get it as high as you think you can go, maybe even try what we call like an eccentric and let go and see if you can slow it down, help it back up again, see if you can slow it down. That would be for shoulder flexion, and I would do some variation of that every single day. So now we're moving on to shoulder abduction. You can see we're sticking with that stability theme. So for the early stage, I'm stabilizing the elbows, the joint below, and I'm stabilizing my body, kind of sort of the joints above, and just focusing on gravity eliminated shoulder abduction. Now, I think everyone needs to work on this, and the reason is because most people are really in the habit of compensating. So if you are someone that your shoulder always goes up when you lift the arm, having all these joints stabilized is a really great position, and doing it gravity eliminated to unlearn that, to break that habit of elevating the shoulder up when you go to try and reach the arm out to the side. And then what you want to do is, again, just keep thinking about pressing the shoulder away from the ear and lifting that arm straight up to the side. So again, pressing the shoulder away from the ear and doing what I call a snow angel. So just lifting that arm straight up out to the side. The other thing that's important to remember for this one is, again, most people want to internally rotate. So keeping that thumb pointing up. And then when you feel like you're ready and you want to progress it and you're not going to compensate by bringing that shoulder up, then you would go against gravity. So again, without bringing that shoulder up, just shoulder abduction against gravity. All right, so for this movement, now we're working on horizontal abduction. So I'm kind of starting a little bit, because this one's a little bit easier for most people. When I'm laying down, I'm starting where it has to work a little bit against gravity. And then I would keep working, even though that's kind of eccentric for the muscles on the inside. I would try and work as much of that range as you can. But again, we're working horizontal abduction. Again, we're stabilizing the joint above and below. So let me show that to you again. I'm kind of helping it a little bit with my other arm, and then I'm just bringing the arm across my body. Very, very important exercise, again, with both joints stabilized. And then to progress that on a less stable body, with the body less stable because you're sitting up, you can use your cane. And I usually just tell people set a couple of weights on the bottom of your cane. Because you're less stable, I do recommend starting with gravity eliminated. So that's what the cane allows you to do. It allows you to keep that shoulder relaxed. You're not driving your shoulders up towards your ears, and just gently let that arm fall out to the side. Now, if you want to make it a little bit harder, you can start it with it angled in, and again, just put a weight on the bottom. But if you start it with it, the base of the cane further out, then you're kind of going against gravity a little bit. So you can just play with that angle a little bit. Again, I would keep the air splint on for this to just stabilize that elbow and allow you to really focus on that shoulder movement. And then from there, we're going to go shoulder extension, or reaching that arm back behind you. The key to this one is you're trying to get the shoulder blade involved. So when you go to lift that arm, think about squeezing that shoulder blade back towards your other shoulder blade or towards your spine as you lift that arm. And then if you can, do the same thing with the arms straight out to the side. Again, we can't neglect that shoulder blade, and those muscles are often neglected. So we're trying to squeeze that shoulder blade back as we lift that arm. All right, now we're going to work on external rotation. Again, gravity eliminated, and you want to hold that elbow in. A lot of times the first tendency is just to move that arm away from the side. So to really work that external rotation, you want to make sure that elbow stays in close to your side. If you want to progress it a little bit, you can put a roll here so that you have to focus on keeping that roll in towards your side as you roll that out. But again, to start, you're just going to hold the elbow in, gravity eliminated, shoulder external rotation. And again, you do have to put something to weight the base down so that the whole cane's not moving side to side when you do it, or you can stand on it if you have enough control in your leg. And again, you're just working that external rotation. If you wanted to advance it a little bit, stick something in there that you have to hold between your arm and the body, and then work it that way. So again, external rotation should be a part of every single home exercise program. And now going down to elbow extension, you're just going to extend that arm up towards the ceiling. Now, I love starting with this exercise with almost everyone, especially those of you who don't think you have any movement in your arm. A lot of people, even if they have no movement, if they get in this position, can extend their arm towards the ceiling, even if you're someone that has a tendency to pull in. So I would not neglect this one, even if you're someone who thinks that you don't have arm movement, but it is a critical movement to get. You want to try and do it so that your arm's not rotated inward. So you don't want your hand or your arm coming across your body. You want to try and keep it as parallel to your body as you can as you lift it up. But again, it's one of those that I think should be a part of everyone's home exercise program. And then the last one for isolated elbow is a bicep curl. So a lot of you don't work on this because your arm involuntarily pulls up. What I would say is that involuntary bending in is part of a pattern, and you still want to work on this isolated elbow extension without letting the arm come across your body. That's going to be really challenging for a lot of you. But again, that is part of what we call like an abnormal pattern. So you do want to work on this isolated without that arm pulling in. So just a bicep curl, trying to keep the palm facing up as you do that. If you just absolutely can't do it without that arm pulling in, go to something with an active assist like a cane. Working on not letting that arm pull in, but allowing that arm to stay pointing straight ahead as it comes up with your palms facing up. And again, I would do that every single day, especially if you're in the first 2 years. And then the last exercise I'm going to show you, which is so important, and I probably don't talk about it enough on this channel, is kind of like a combination movement. A movement that involves all of the joints in the arm to work in a coordinated manner together. The one that I think is the most critical is what they call D2 flexion, or what I like to say is just pulling a sword out of your pocket. That would be the ideal movement pattern for anyone after a neurologic injury, and it is by far the hardest to coordinate external rotation at the arm as you lift it up, as you extend the elbow, as you supinate the hand. Supination is holding a bowl of soup in your hand and extending up towards the ceiling. So again, we're going to start with maximum stability. So you're going to start laying down, bring that arm across your body, and then it's like you're pulling a sword out of your pocket as you bring that arm up and at an angle. And then back down would be D2 extension, and then back up would be D2 flexion. You're externally rotating the arm, extending the elbow, and supinating the hand as much as possible and extending the wrist as much as possible. If you need to help it, definitely feel free to help it. If it's just too many moving parts, you can put the air splint back on and try this. But again, I would call this the most advanced, where we want to try and coordinate all joints moving in synchrony together. Now, that is it for the shoulder and the elbow. But before we dive into the wrist and the hand, I am going to preface this with the fact or the idea that you definitely need the shoulder and the elbow in order to move the wrist. But where I have made the mistake in previous videos, and I really do, I'm making this video to make this correction, where I've made the mistake is I've really emphasized that if you can't move the shoulder and the elbow, you shouldn't work on the wrist and the hand, although that's not really what I meant. I really just meant that you really need to focus on the shoulder and the elbow, but you really need to work all three. So in error, I probably gave the impression that I don't think you should work on the hand until you get the wrist and the shoulder, when that is absolutely not the case. You do want to start working the hand from day one. I just think that the shoulder and the elbow get neglected because everyone wants to get that hand back, and so they only focus on the hand and they neglect the shoulder and the elbow. So definitely you need to work on the shoulder and the elbow, but you don't want to neglect the hand. But as we go into the hand, don't forget that you do need the shoulder and the elbow in order to functionally use a hand. If you can't get the arm away from your body, you're not going to be able to grab anything. That's point of emphasis number one. Point of emphasis number two is that if you are stuck in a fisted hand, you are not going to be able to get that hand open if you are not daily stretching. So I do think having a splint is absolutely critical. So this is just a hand paddle that someone makes here locally for me, and it just has these straps on it that will help to hold your hand open. It's just going to make your life easier. I do have another variation of this that also involves the wrist, but for some of you that just want something simple and something that's easy to get on, something similar to this, and I see some of people online and on Instagram and stuff, they already use something like this. So I do think that you're just fighting an uphill battle if you work on the wrists and the hand and your arm isn't a fist. So I highly recommend something like this. The other thing I will say is that I've seen some people that have an ace wrap over the top of this. Absolutely, you do not want to use an ace wrap. So the problem with an ace wrap is there's give in it. So your hand is either going to curl up a little bit, or if it doesn't curl up, you have to make that ace wrap so tight that you're going to cut off circulation in order to not get those fingers to bend up. You want a rigid strap. The blue strap has a little bit of stretch in it, but not nearly as much as an ace wrap. You want your fingers and your brain to know that as soon as they start to curl up, that strap is going to quickly stop it, right? So an ace wrap, there's just either too much give where your fingers are allowed to move too much and your brain's not going to really learn, like, nope, don't do that. Or you're going to have to put that ace wrap so tight that it's going to cut off circulation. So you definitely need something that does not stretch. You can use this. I've also used not duct tape, but I've used something called transport tape that I will put a link for that in the description below as well. But just keep that in mind. The splinting is so important to restoring normal movement. So I just wanted to say that before we dive into the arm component or the wrist and the hand component of this. Highly recommend something like this. All right, now that we have gotten through some of the upper part of the arm, let's get to the part of the arm that most of you ask questions about or want more exercises with. So first we're just going to go over pronation and supination. Now remember, pronation is palms facing down. Supination is palms facing up. The way I like to remember that is like you're holding a bowl of soup in the air. So supination is palms facing up. In most cases, what most of you ask me about is how to supinate the forearm. So supination is palm facing up. I always recommend that if you can do this at the beginning with something on your hand to keep your hand open, I do think you're going to have more success with the supination. So if you have a splint, definitely wear a splint. I always recommend starting with gravity assisted. So just kind of holding the hand, bringing it to neutral, and then just seeing if you can let it fall. Now remember, most of you, the reason you can't supinate your hand is because your pronators and your flexors that pull it in and down are just overpowering it, or they're a little bit more active. So at the beginning, the goal is to get those muscles to relax. So the cue you want to be giving yourself is just relax and just let it fall. So back to neutral, just relax and let it fall. All right, I'm gonna cup the wrist or the forearm just a little bit so I can help it, just a tiny bit. I just kind of tip it in that direction. And remember, you're just trying to get feedback to your brain. You want your brain to connect with this movement. So it is okay to help it a little just to get your brain to connect with that movement, and just let it fall. And let it fall. And let it fall. And then once you get really good at that, then you can start trying to bring it kind of gravity against gravity, where you're going to start with it pronated or palm facing down and try and get it all the way over. Now again, it is going to be easier if you do have something on your hand pulling your thumb out to the side. When your thumb is in, people have a tendency to have a little bit more tone in their hand in many cases. So something that pulls your thumb out to the side is ideal. And then again, you're trying to just flip that hand over. The other one that I like with the paddle on now, so you can really isolate the wrist, is just trying to extend the wrist. Just extending it back. So see, when you have that hand fixed and have that fingers open, it's really a lot easier to kind of isolate some of these movements. So again, now we're just going into wrist extension. Against gravity would be lifting it in this direction. So first, before we get to like really fine motor, let's just work on the thumb. So we're going to work on thumb up. So a quick stretch can sometimes help with this if you're not high tone. If you're high tone, this might just make the tone worse. But you just want to pull down and let go and try and lift that thumb up. So sometimes giving a little downward quick stretch followed by lifting it up sometimes can help. So quick stretch down, and as soon as you let go, you want to try and do that thumb up. Quick stretch down and try and do that thumb up. Quick stretch down and thumb up. Quick stretch down and thumb up. All right, now to get to more of the fine motor in the hand, very, very easy. First, you're just going to try and do opposition. Each finger getting the pads of the fingers to touch. So you don't want them drawing in that way, but you want to get the pads of the fingers to touch and trying to go to each finger. That would be like the beginning stages of working on that fine motor. And then from there, what I would do is find like, you know, condiment packets or marbles, or even grapes would be even better, or blueberries, even though it might get a little messy. But if you add food to it, it's adding a very meaningful activity, meaning our brain has a tendency to want to focus on more meaningful activities a little bit more. So you can find different finger foods that are easy to pick up, potato chips, anything like that, to kind of work on that dexterity in your fingers. But if you're not there, don't give up. Keep working on that shoulder and that elbow. I can't state it enough. Don't give up on that hand. If there is your hand, you're just getting frustrated because the hand never opens, definitely try and find something to keep that hand open, some kind of a splint to keep that hand open. And then that is it for this video. That is kind of the Cliff Notes version of how I would structure an upper extremity home exercise program. If you're in the first 2 years, and I've talked about this in other videos as well, if you're in the first 2 years, I think probably spending an hour a day on the arm is probably the most beneficial. And everything that we went through, in an hour, you could get through the shoulder stretches and the movement retaining, elbow, wrist, and hand, probably all within an hour. But it really is the consistency of doing it every day. And then in between your scheduled therapy times that you're doing on your own, trying to incorporate that hand into as many activities as possible is super, super duper valuable. So I hope this video helped for some of you that are new. Again, I will put links to previous video series that I've done on the upper extremity, where I go into each one of these sections in a little bit more depth. For those of you that have been around for a while, I hope it was a good refresher. If you want to get your specific questions answered, definitely join us for our monthly lives. The link for that is in the description below. With your membership, you also get access to our Discord channel, where you can communicate with other people in this community. So I'd love to see you guys in the lives and on Discord in the discussion. So hopefully you will check that out. I enjoyed spending time with you all today, and I will see you in the next video. Have a good day.